And your position with MLB?
Vice President of Drug Health and Safety Programs.
So does that mean that you oversee all of those programs?
Yes, and work closely with others that work on those programs. So my job is to kind of oversee them. When we're not in a pandemic, I oversee our drug testing, anti-doping, PED programs. But over time, that has, primarily because of the relationships with the doctors and the experts that we get to work with, that has morphed into more traditional medical and health programs, like our concussion program, tobacco program, different treatment programs. And we never thought we'd be dealing with something like this, but infectious disease generally is an issue within sports because of the clubhouse space and the close proximity that people spend time together. And so myself, as well as a few others, those that run our facilities, medical experts that we work with, we kind of formed a task force early on to start dealing with this issue.
When this started to roll out in February and March, did you think that you would still start on time?
I'm an optimist to a fault, and I think when we started looking into this issue in February, we have a very close relationship with the other leagues, and we also have a presence in Asia. And so we were given a heads up that this is coming. And in speaking with folks from the NBA and the other leagues, they knew that this could be something that could impact us. So it started off as just kind of informational, educational for ourselves and our teams. But I think it became apparent pretty early on that this was going to impact how we start and when we start. I don't think anyone thought that we would still be in the midst of this now. I think we were hoping that when the weather got warmer, that's what our experts were advising us, that this could dissipate if we can get it under control at some point during the season. But by the time spring training rolled around, we had to shut down. When it was time to open back up, we realized that this was going to be something that we'd be dealing with for the entire season.
At what point did you realize, we might be able to get a condensed season in?
Yeah, so we took our time throughout this whole process, this whole situation. We've been led by medical experts, and it's been very clear from those that I work for that we're going to be guided by them, and we're not going to do anything that puts anyone at risk. And as part of that, playing a shorter season, taking a look at the travel that we engage in, taking a look at the time that we spend at the ballparks, is something that we were very cognizant of, as something that we had to adjust. And that's kind of, all of the professional sports were impacted by this, for sure. The NBA and the NHL, I'm big fans of both. They both had their postseasons pulled right before they were starting to play. We were the only sport, though, that had to face a full season. So we had to come back and play a spring training. The consideration was, how much time do players need to not only stay infection free, but how do they get prepared? Their tools of their trade are their elbows and their shoulders. They need to get those ready. We needed to participate in a condensed spring training that would not drag things out too long, but wouldn't create additional health risks. And then we had to try to fit into a season that would not go overboard from a travel perspective, but we were also being advised that by the time November rolls around, there could be another issue again, this whole issue of a second spike. So kind of the marching orders, kind of the plan throughout our planning stages were, let's get as many games in as we possibly can play. We had to work with the Players Association. Just like all professional sports in the U.S., our athletes are represented by a union. We have a good relationship with them and a good working relationship. We needed to figure out what is the appropriate number of games. And we also wanted to make sure that we got to a postseason, we're able to get through that postseason.
You talk about the union. It seemed to me as a giant baseball fan that there appeared to be a wall at one point, and I didn't know if a season was going to happen. What finally got everybody past that line?
Yeah, well, I don't think there's any disagreement that we all wanted to play, but we wanted to do so in a safe way, and we had to do it in a way that made economic sense for both players and management, the clubs. From where I sit at the commissioner's office, we represent the club interest, but with my specific role, I keep out of the economic negotiations. Our medical experts, my counterparts at the Players Union, there are times that we disagree, but it's usually on the details. It's not on the major focuses. And throughout this entire process, I can say with a lot of confidence that we were being driven by player health and safety. That is the shared goal, and we're not going to do anything or even discuss anything, and certainly not reach any agreements that would put that at risk.
A lot of players did want to play, as you noted. You talked about player health. I saw a tweet from David Price at some point saying he felt the league was putting other interests above players' interests, different from what I saw from some other players. What would be your response to that?
Yeah, I think, again, not to be repetitive, but at no point would we ever put player health and safety at risk. I mean, that's not what we're doing, and that's, not the guidance that we're receiving. But we also, the commissioner's been very clear, and the commissioner's been incredible on this. I mean, this is a set of issues that no commissioner has ever faced in any professional sports setting. He's made it very clear from the beginning that no one's being forced to play. And if you don't want to play, that's your choice, that's your right. And we've had players that have opted out for health reasons, those that may have a pre-existing condition, and those players that, for family reasons or other reasons that are personal to them, they've decided to not play, and that's okay. And they can come back next year, and hopefully, knock on wood, we won't be dealing with this at that point.
Why do you feel it was important for the sport to pick up again?
Very good question, and that's been, for me personally, but also for our office, I can tell you that's been a driving force behind this whole ordeal. Throughout history, throughout kind of my life, but throughout the life of professional baseball, the league, the sport has been in kind of a representation of the country, kind of instilled in the fabric of the U.S., if you will. Former Commissioner Selig used to always say that baseball is a social institution, and I think we realized early on that we have an opportunity here to highlight how to go about this in a safe and effective way, to be able to use our platform to talk about things like proper masking, proper distancing, like we're sitting right here. How do you go back to work in a safe way and keep your employees safe, keeping their families safe? And so in that same way here, this has been a very challenging time for our country for a variety of reasons. We want to develop a plan, and I think we have, where we can safely go back to work at a time when offices are reopening, schools are reopening. This is one option for considering how you go about doing that. But also, just from a pure entertainment standpoint and giving people a break, this has been very challenging the last few months. And if you can provide fans of the game or those that are coming to baseball for the first time an opportunity to watch a ball game on TV for a few hours, to give them something to read about, something to think about that's not COVID-19 related, I don't think that could be understated.
Yeah, I've certainly taken part in that. It must have been a bit nerve-wracking when everything went down with the Marlins.
Yeah. For
you in particular.
Absolutely. We have to be realistic. I mean, going into this, we knew that positive tests were going to be an unavoidable circumstance. I mean, we're playing in the midst of a pandemic where, we're dealing with a very infectious disease, and we're talking about, groups of men that are traveling together, playing together, and, we're not playing out of a bubble. We made a conscious decision early on that because of the fact that we were starting our season and just the sheer volume of games and the sheer volume of people, that a bubble just wouldn't work. So we knew that this was going to be, not without risk, I guess is the proper way to say it. But, the Marlins situation spun out of control rather quickly. But, again, we got our experts involved early on. We attempted to contain it to the extent possible. It is what it is. I can't say enough good things. I mean, the Marlins dealt with it in stride. From ownership on down. The Phillies in particular, most of these situations occurred in the city of Philadelphia, and the Phillies could not have been more supportive and offered assistance to their competitor, which was great, the city of Philadelphia as well. We got through that, and I think the best thing I can say about that situation is that we learned from it. We were flexible, we adjusted to it. Immediately after that occurred, we put out updates to our protocols based upon the learnings from that situation. And knock on wood, we've had a very strong run since then. Again, I'll take the optimistic view, but while the situation with the Marlins was difficult, it's now behind us. The majority of those players have been medically cleared to return, so it's something that we can look at in our rearview mirror. But we have 28 other clubs, well, 27 now, that have not had a positive test in weeks throughout the entire season. So while, again, those sort of, hopefully we can avoid mini outbreaks, but positive tests are absolutely unavoidable, but the vast majority of our clubs are doing an absolutely fantastic job.
What steps were taken after that? I heard that a representative was sent to each team or monitor.
Yes, yeah, that's one of the adjustments we made. We added compliance officers. There are already point people at each organization. Each club has a doctor. They have a set of athletic trainers, which we are very close with. We made sure with the first iteration of our operations manual that an infection control person was appointed at each club. But because we're not living in a bubble, we're not playing in a bubble, the players and club staff are going back and forth to home each night. And if they're on the road, they are not on lockdown, even though we advise them to be as cautious with their behavior and conduct as they possibly can be. But it became apparent that just making sure that strict adherence to protocols occurred, that someone to oversee that was necessary. So with respect to club travel, whether it's on the road, meaning in a bus, or in the air in certain instances, while individuals are at their hotels, making sure that they're not kind of being drawn in by public spaces, they're not going to restaurants, they're not going to bars. We give flexibility to the players and to the club staff to engage in certain types of behavior. For example, if they want to go out for a run in the morning, that's okay. But if they want to go out to a bar to grab a beer, that's not. And so putting in that compliance monitor was a very important step. One of the individuals that I work closely with, Brian Seeley, who runs our investigations group, but he also oversees club security. He's been he's been leading a lot of this, and he's been overseeing those compliance officers. And it's just an extra layer of protection to make sure that we have very strict, important protocols in place, and to the extent that we can try to get guys to comply, that's the goal.
Yep. To state the obvious, you have a rather unique job. How did you fall into it?
So I went to U of R for undergrad, went to law school up in Buffalo, and after law school, my now wife and I decided to take a risk, moved on to New York City. The thought was always to try to break into some sports and entertainment law opportunity. Never thought I'd be lucky enough to work in baseball, but the opportunity presented itself pretty early on. At the time when I was looking for jobs, when I was kind of coming right out of school, baseball was in the midst of all of the anabolic steroid issues with Senator George Mitchell's investigation, and not being in the strong place that they are right now. And so a number of opportunities that didn't previously exist presented themselves in that time frame. So even in New York City, I've said this to many people, it is about who you know, and if you work hard and if you do a good job for people, if the opportunity presents itself, you can break into even a tough industry like baseball. And I was lucky enough to do that, but I also realized early on, if you're going to be lucky enough to get a job like this, you just don't give it up. So 13 years later, I'm still working there.
Welcome to my world. How does it work working for such a major organization that has obviously offices, if you will, all across the country, while living in Rochester, New York?
Yeah, it's I kept it under wraps for a while, and now the cat is out of the bag. So it's one where it all comes down to having really wonderful people that I work with and for. The idea to move up here, which I did about 5 years ago, was a suggestion from the attorney that I work for, and it was one where, while certainly the priority at our office is hard work and putting in as much time and dedication as you can to the job, family is also important. And when children started coming, giving them kind of a situation or a lifestyle that I was looking for is something that I communicated, and the suggestion to try a remote working situation came from above. So it wasn't even something that I had to suggest. But you have to have flexible people that you work for. I work with some great colleagues that are always willing to kind of be my eyes and ears in the office when I'm not physically there. But I also think it comes down to, the nature of baseball is a nationwide industry. I mean, we have offices in New York, which I do go down to just about every week. But we have offices in Boulder, Colorado. We have offices in San Francisco. We have 30 major league clubs spread throughout the country. And most of the men and women that I work with do not spend a lot of time in the office. They're either traveling to meetings, they're traveling to different, different games or club activities. And so the need to all physically being in the same place is not really necessary. But I also think it comes down to with the kind of the individualized nature of my job. We do have a small team in the drug health and safety world, and hopefully after this is done that team will grow. But it is one where I work just as closely with people that are outside of New York as they are within New York. So we have testing laboratories in Montreal, Los Angeles, and Salt Lake City. Speak to them regularly. We have consultants that live in LA, Kansas City, down in North Carolina, in Cleveland. So kind of my team of consultants and inner circle is spread out pretty significantly. So at the end of the day, it really doesn't matter where you work from as long as you're available at all times. Yeah. And we also have, I have to give a shout out to our, one of the main reasons we've been able to make it work is just the incredible ability of our IT department to set it up here where I feel like I'm in the office. I have an office phone. I have all of the infrastructure that's required. Where I went a good year without telling anyone that I was living up here.
Wow,
which was pretty neat. I mean, it
even
was just,
within the organization.
Yeah, it was just one where because you're picking up the phone, you're there, and I had a pretty constant presence down there anyway. But it is one where it's important to not take advantage of it in an inappropriate way. I would say for the camera that I definitely put more hours in from here than down there because you're not commuting.
Yeah.
And so I start my day very early in the morning and I end it very late at night.
Yeah, I can imagine.
Yeah.
How has the move been for you?
It's been, happy life, happy wife, happy life for sure. I have two beautiful daughters at home. They, are got a daughter going into second grade, a daughter going into kindergarten. I mean, they love their situation. We have a great neighborhood. We have, family that's close by. I mean, that's what it's all about. And when you can combine that with a job that's certainly demanding, but one that I feel I very much enjoy, but I feel it's important work. I mean, in the midst of this pandemic, it's been a very, very difficult situation for my family just because you're always on, we haven't had a day off since February, but it's fine because I do think it's important, and for all the reasons that we talked about earlier, bringing baseball back, providing a sense of entertainment and a distraction for people, it wouldn't be possible without the health and safety protocols, and so I think that it's one where we just need to get through this and we can take a break in November.